Well, the training program really consists of a number of different steps. So to begin with, there are 9 undergraduate courses that are required as sort of the biomedical foundation for the clinical psychopharmacology training. And I have found that to be just excellent as sort of building the foundation for understanding physiological systems. And the clinical psychopharmacology program, the master's level program at FDU, is the one that I attended, and it was superb. It really covered a lot with regard to psychopathology, pathophysiology, as well as understanding neural systems as it pertains to psychological conditions. Now, that was a 2-year program that then was followed by an in-person physical assessment course, which was very hands-on and very practical for what prescribing psychologists will need to understand in terms of physical assessment. That was 80 hours, yes, and it was led by instruction, modeling, and then doing. And so by the end of that week, we certainly felt like we had a great grasp of the general principles of physical assessment, and then that puts us in a position to then benefit from our clinical rotation experience when we'll be doing more hands-on psychopharmacology type training as well as physical assessment.
And then you are taking your PEP?
Yes, that will be coming in the next month or 2.
Okay, so that's a pretty tough exam.
Yes, but I think people who do this welcome the challenge. And as part of the MS in psychopharmacology, there was a qualifying exam, which is really a great way of preparing us for the PEP. And so, again, like any other training that we've all been through, we need to have those type of experiences to help us integrate information from diverse sort of topic areas, and the PEP will certainly do that. So I'm looking forward to it, and quite frankly am a bit invigorated by the fact that that's coming up soon. Well, the way it's designed is that there are rotations encompassing 9 different specialty areas: neurology, psychiatry, family medicine, internal medicine, OB/GYN, surgery, and so on. And the expectation that I have is that it will bring together a lot of the questions that those of us that have worked in medical settings have had, but maybe had some ambiguity about. And so when you work in a medical setting as a psychologist or neuropsychologist, you're faced with reviewing charts and going into a bit of a deep dive into the medical history of the patient, but sometimes it's a little bit of a challenge to conceptualize what's going on without more formal training in the biomedical sciences. And so my expectation is that when I'm on the floors and I'm consulting in a hospital setting, that I'll be able to go through a chart and really break down what the essential elements are in terms of conceptualizing that patient's medical status as it pertains to the psychopharmacological decisions that will need to be made for that particular patient. And so I'm really looking forward to internal medicine. A little bit intimidating because it's such a broad area, of course, of knowledge, but I think that's going to be superb in terms of bringing together the general medical aspects of a patient's care in preparation for psychopharmacological decisions. So again, looking very much forward to it, and the expectation is that after the 14-month rotation experience, that consulting on hospital floors and in medical centers will get much more productive. And Loyola is as you mentioned, a world-class facility. They have been known for a very long time in terms of their neurology, neurosurgery department being really exceptional in terms of their breadth of expertise. But all of their medical specialties are really delivered at a high level. And so it affords us a lot of opportunities on the inpatient side as well as the outpatient side for experiencing the kind of training that this type of paradigm calls for. A collegial type of environment set up when everyone is in training together. And so there's a lot to be learned from medical students. There's a lot to be learned from residents in terms of the culture of the biomedical environment. as well as for us to bring our expertise to the table in terms of helping the general team understand some of the psychosocial issues and what aspects of psychological pathology is contributing to what is happening clinically in the medical setting. So I expect and look forward to learning from them and also getting a sort of level of energy from being around students and residents that are knee-deep in learning and dedicated to perfecting their craft. Yes, well, I was the oldest guy in the class, every class. It was a lot of fun because, with one exception, I found it to be necessary because as an undergrad, I had some coursework in physiology and some coursework in psychophysiology and so on. But I believe you really need to start from the ground up in terms of understanding chemistry, understanding human anatomy, and biological processes. And so this type of preparation for the MS and for the rotations, I think, is really an essential component to it. And for some, that may feel a bit daunting. How do I fit it into my schedule? And how do I get back into the classroom in this way? But quite frankly, with a little bit of flexibility and finding the right place that has flexibility in their schedule, a practicing psychologist can really work it into their day-to-day regimen. And I think one of the most fulfilling experiences I've had was in my anatomy and physiology with cadaver class. There's something about being up close to human anatomy and human physiology that deepens your understanding and appreciation, for that matter, of how the human body works beyond what can be gleaned from textbooks. And so when I go back to the textbooks, I have a different level of if you will, intimacy with what those textbooks are trying to communicate and conceptualize. So that was really a nice experience. As a neuropsychologist, obviously I spend a lot of my time assessing and diagnosing, and I really think that this is the natural next step in terms of being able to really pinpoint what psychopharmacological approaches and also psychotherapeutic approaches and also further medical workup that may be necessary for this particular patient. And so I feel like it can really enrich my recommendation section, whether I'm the one prescribing or I'm consulting to someone else who will be doing the prescribing. I feel like taking all of this information about the patient will really increase the quality of what I can say in my recommendation section in terms of what this particular patient may need, pharmacologically speaking. The other part of this that I'm really excited about is looking at biomarkers. And so the way that different medical specialties have moved in recent years is toward personalized medicine. And so not just treating the specific condition or the symptoms, but understanding the specific neurobiological makeup of this particular patient, and then choosing a therapeutic approach that is customized to that person's biological or neurophysiological makeup. And so as part of the assessment process, whether it be assessing pharmacogenomics or assessing brain metrics, to be able to look at the patient not only symptomatically or psychologically, but also understanding what biomarkers are relevant and salient for that particular patient, and then customizing the approach based on that. And I think that's really the next sort of chapter in addressing what really is a sophisticated and complex question that often we get faced with in terms of improving someone's mental health. Certainly. So one good example would be a patient that comes in with depression and anxiety and obsessive tendencies. And when we do a neuropsych evaluation in a brain map, we see that this region toward the front of the brain called the anterior cingulate is overactive. And so they can't not think about that which they ought not think about. They simply ruminate, they have intrusive thoughts, and it markedly impacts their quality of life. Now, from a neurofeedback standpoint or a neuromodulation standpoint, we would address that particular network via sensor technologies. However, that's a patient that may also respond very well to a medication that's been shown to influence that neural circuitry. So, for instance, Effexor would be one example of that, an SNRI, which may be a useful choice to address not only that symptom, but that specific circuitry that is dysregulated. And so, and then potentially addressing it from both angles if one is incompletely effective or only partially effective. And so I really feel like that could allow me to do more for my patients, because I think a lot of us in the field, we want to help. And we also want to feel like we're doing everything we possibly can for this particular patient because they put their trust in us, they put their time and resource, and I always want to feel like they're getting the best service I can possibly give them. I think the first piece of it is for psychologists to be able to be elbow to elbow with physicians and nurse practitioners and so on, and being able to conceptualize things medically. That's your entry into primary care. Then psychologists can take it to the next step, which is the very practical nature of psychopharmacological decisions, as well as being able to conceptualize what's going on in terms of psychodynamics. And so for that package to be sort of complete, I think allows us to be extraordinarily valuable in a primary care setting. And as we all know, medications and biological approaches are, for many patients, extraordinarily important and essential. However, for many patients, some would say for most patients, it's not everything. And so for psychology to start from the ground up, understanding psychodynamics, understanding psychological theory, understanding specific and effective methodologies for delivering psychotherapy, for being able to test and assess, to have that type of foundation first, and then build on the neurobiological and psychopharmacological knowledge, I think is an excellent paradigm and really represents a new breed of mental health expert. And so I really like the fact that it is designed and laid out that way, and certainly hope that others in our state and other states also really begin and continue to understand the value of that, because people are suffering every day with mental health issues, and it's incumbent upon us as a profession to meet that need in as many different ways as we can.